Welcome to BDI Briefs, where we take a brief look at important issues about the emotional side of diabetes. Thanks so much for joining us today. I'm here with Dr. Bill Polonsky, president of the Behavioral Diabetes Institute, and Dr. Susan Guzman, director of clinical education at the Behavioral Diabetes Institute. Both are world renowned diabetes psychologists and two people I'm very glad to have on my side as I navigate life with diabetes. My name is Scott Johnson. I've lived with diabetes for over 40 years and have been active in the diabetes social media space and industry for a long time. And with introductions out of the way, what are we talking about today?
Well, thanks, Scott. Like we've done in previous programs, I've tried to search the literature and say, I want to find some new publication that really seems important, both for healthcare providers working in diabetes and also just for regular folks living every day with diabetes. And so I found this really amazing article. It's about what's called the hypoglycemic fear syndrome and written by some really impressive authors. Oh, wait, that's us. So this is an article that Susan and I wrote with our colleague, Dr. Larry Fisher. Professor Fisher is from the University of California in San Francisco. And it's a subject that's near and dear to our heart because Susan and I have done some very long, all day long programs, workshops for healthcare providers to help them to be informed on this topic. So just to set the stage, and Susan, I want you to chime in. Scott, you're going to chime in because I'm sure you are very aware of this topic. We want to talk about, fear of hypoglycemia. We know that it's really normal for people with type 1 diabetes and for lots and lots of people with type 2 diabetes to be uncomfortable and worry that, hypoglycemia could harm them, can make them uncomfortable. But in this article, we wanted to focus on a subset of those. It's what we call the hypoglycemic fear syndrome. And these are people who have not just a little bit of concern and fear about hypoglycemia, but have a lot of fears. In fact, those fears are so strong that they tend to keep their blood sugars too high all the time because they're so freaked out about the fact that they might go low and something bad could happen. And what's really quite remarkable about this is even though I can tell you for a fact that there have been publications and studies looking at the problem of fear of hypoglycemia for more than 35 years, what's funny is that there's very little written about what to do about it, which is really striking. I continue to be surprised. There was a great article not too many years ago written by one of our colleagues in Canada named Michael Vallis, who actually wrote a lovely article saying, well, here's how we think about what can be done, how to address really profound fear of hypoglycemia. And it really struck me that, well, wait a minute, we do this all the time. We should be taking a look at what we did. So Susan and I, in collaboration with Larry, sat down and said, let's try to bring it all together, citing what literature we can, also looking at our own experiences. So I don't know, before I say anything more about that, Susan, do you want to chime in about this?
Well, I think that pulling from the paper, the most important thing to focus on is how we've structured it. So based on the two ways that we are encouraging people to take a look at this challenge, which is ways to be safe and ways to feel safe. And I think that while that may sound like they should both be the same things, they're not. Well, there's some overlap, but they're actually different things to actually literally be safe from hypoglycemia and to feel safe. Because some people are not at greater risk for hypoglycemia, but they don't feel safe. And so they often require separate strategies. So, I really encourage people to take a look at both the be safe and feel safe strategy.
Right. And we want to spend all of our time actually going through some of the details of those two sets of strategies, be safe and feel safe. But Scott, I need you to chime in because I think one of the things that, you offer that I can't is that you're living every day with type 1 diabetes. And this idea that despite the fact you may have all of this together, we know it's common to have times when you can get kind of freaked out. What do you think? Anything you want to mention about that for you?
Well, just that this definitely hits home for me. In my adult life with diabetes, I have experienced a couple of severe hypoglycemic events where I needed assistance, and it was indeed traumatizing and affected months. It affected me for months afterward. And I also just want to kind of recognize that the safest area for us to walk with diabetes is kind of right next to the cliff, as close to normal as possible. Doesn't leave much room for error in that low blood sugar range. So we walk a tricky tightrope.
It's the frying pan of the fire, right? We understand that. And so we know that oftentimes, just like you experienced, it can be just one bad low, can be almost like it's a trauma, and it leads to what almost is sort of a form of post-traumatic stress disorder, where it can reverberate over years, decades even, so that people become so scared, again, they're just going to say, well, I don't want to be this scared, so I'll just ride high all the time. And so what we've seen over the course of years, and this is what Susan's talking about, sometimes what's going on is that people really are in danger of severe low. And so our job has to be, you say, well, what do we need to do to help people to be safe? For lots of people, though, it turns out that's not enough. You can actually help them to be safe or get safer so that the risk of going low is less. But they're still freaked out. And so we have to have separate strategies that look at, can we help people to feel safe? And by the way, sometimes we've dealt with folks who actually, physiologically speaking, they are safe. They're not really at any risk of going low, but they're still freaked out. So that's when we want to focus on our feel safe strategies more. So sometimes we'll use be safe strategies. Sometimes we'll talk about feel safe. And lots of times we have to do both. So I hope that sets the stage well. Susan, I interrupted you because you were getting into it. So the first set of strategies is what we call be safe strategies, to help make sure for someone who's freaked out that we can help them to take action so that the risk of becoming low is, well, not so bad. And so again, we look at medical interventions, we look at behavioral intervention, but Susan, I'm going to turn over to you. Let's walk through some of our be safe strategies. And there are 6 of them.
Sure. Well, the first one is to optimize medication. So obviously, if, somebody has their dosage wrong with, their basal rates or their correction factors or something like that with insulin, or perhaps they're on oral medications that are on the wrong, not optimized dosage, they're at more risk for hypoglycemia. And we want to, obviously, that would be a great place to start. Um, the other thing that I find is a little bit sneaky for people sometimes is the second one, which is to be prepared to treat appropriately. A lot of times when people have a low, they choose their treatment with something that isn't actually a really fast acting carb. I remember one of our good friends to BDI said, she hates to waste a hypoglycemic treatment on, glucose tablets or something like that when, that's a good opportunity to eat a candy bar or a cookie and not have to feel bad about it. But unfortunately, when you select not fast acting carbs, that then, people can have some problems from that. And also sometimes people will think that, more equals faster. That's a common experience because, your brain's saying like get out fast. And people will sometimes think, well, I should just keep consuming carbohydrates until I feel better, which is a normal response when you have that fight or flight going off in your brain. But unfortunately, more does not equal faster. And then people end up, having a high later that they end up chasing, sometimes followed by another low. I had that happen to one of the people I worked with yesterday. And saw how she chased both directions from that problem.
I mean, it's really that's a big problem for me. I want to also acknowledge that those feelings when your blood sugar is low, they're downright primitive survival. Eat everything you can see, and it takes incredible discipline to treat a low rationally, and then just kind of sit on your hands and wait. It's so hard.
Yeah, and that isn't always possible for everyone, and I think that we need to acknowledge that, right?
And I don't want to get us distracted about how you could treat your low perfectly.
Yeah,
We just want to make sure people are
safe.
again safe, being
Yeah.
safe, why do they even have stuff? I mean, how many times over the past 30 years have I met people who said, yeah, I was out for a run, I started feeling low, and I went, oh yeah, I didn't bring anything with me. Are you kidding? So, I mean, little things about, do you have stuff in your glove compartment in your car? You prepare. We now live in a different world where we have stable glucagon. We have glucagon you can just puff into your nose. We have glucagon that isn't one of these fancy kits that you have to like have someone mix all this stuff. Do you have stuff around that can help you or help your loved one help you in case of an emergency? So these are, I hope, obvious points, but oftentimes we spend a lot of time just making sure these are things that can help people to be safe. All right, I interrupted you, Susan. Let's
No.
look
Wait,
at
wait,
be safe
chime,
strategy.
both of you chime in whenever. The other one is to I went on probably all of our favorites, which is to encourage adoption of diabetes technology, continuous glucose monitoring, or the new automated insulin delivery pumps. Those are, I think being game changers for people with this challenge.
Yeah, I mean, there's no question. And there's been lots of studies. I've been a part of several of them that have shown just introducing CGM. Again, CGM stands for continuous glucose monitoring, especially for people with type 1 diabetes, really can have a quite significant impact on reducing fears about hypoglycemia. And why wouldn't it? This is the first time you really know where you are and where you're headed.
Yeah. And you hear a lot about people describing their challenges feeling their lows. So addressing impaired awareness of hypoglycemia by helping them pay attention to better identify and respond to the early warning signs of hypoglycemia. Sometimes people actually get very good at ignoring the symptoms of hypoglycemia, where they actually think they're not feeling them. But if they practice tuning in, a lot of people begin to become more aware of the subtle symptoms that they've actually practiced sort of pushing through. I wonder if you've had that experience, Scott.
You know, I don't think so. I feel like I recognize my lows. That being said, I'm sure there are symptoms that happen before the symptoms I'm talking about that maybe I do push through because lows are interruptions, right?
Mhm.
They're pulling you away from whatever your attention was focused on. So I initially say no, but after some more thought, probably so. Yeah.
Mhm.
And just to highlight, we do meet lots of folks who become very fearful of lows. And again, they have a particularly one good reason, which is that they aren't feeling their lows.
Mhm.
And that's really scary. That's why
Yeah.
CGM is useful. But also the reason we have this highlighted on this slide, and is one of our important strategies, is that we actually know there are steps you can take to begin to restore awareness of hypoglycemia. Maybe not completely, but can help people to regain some of those cues. And we're not going to go into details about that, but there's a whole body of literature about that we can happily share with people as well. So what
Right.
else? Susie, got two more.
Yeah, I think probably one of the things that we talk about a lot is just establishing a no delay, and I would add non-negotiable glucose value that you call hypoglycemia. So if you have a number, say 70 milligrams per deciliter, that you identify as a low, that's the number that you agree that no matter what, no matter how inconvenient, no matter how much it's a problem in the middle of whatever it's interrupting, that you have a promise to yourself that you're going to not delay and not negotiate with it, that you're going to respond to it.
Really good point. And again, the last one you want to mention about that as well.
Just and identifying times of elevated risk, to make sure that people understand, like after a severe low, for example, they may be at higher risk for another hypoglycemia event. But also like exercise, but people identifying times when they maybe need to pay closer attention or plan ahead, or like that going out for a hike thing that you used as an example earlier, Bill.
So again, all these things, these six strategies, and there are more, but we think these are the key ones that can help people to actually be safer. But again, so many of the folks we see struggling with this hypo fear syndrome, it's not enough. So that's what we talk about, these other set of strategies, what we call feel safe. And so those are listed on the slide that you can see. There's four of them. And the first one, you're going to say, wait a minute, didn't we just talk about that? There's This one is about, again, encouraging the adoption of our cool new diabetes technology. And especially we're talking about continuous glucose monitoring. But for those of you who are on insulin, especially their type 1, we have what are called automated insulin delivery systems, what are sometimes called hybrid closing systems that can really make a difference, not just in being safer, but again, helping people to feel more confident that they can be okay, that they're going to be able to catch problems before they happen. And this is why we list it twice, because we see it as so important.
Okay.
Um, the second one I'll mention of the four is written, it says it talks about helping people to be clear about what's called symptom discrimination. And what this is about is sometimes when you're having a low, Scott, I don't know if that's ever happened to you, but often you're not sure what it is. Am I having a low or am I just feeling weird and funny? The problem is a lot of what are called neurogenic cues. Your adrenal gland shoots off all sorts of interesting hormones when you're having a low, are the same hormones that are spewed out by your body when you get scared. So we see lots of people who will say, "Uh-oh, I can feel my heart palpitating." Does that mean I'm low? Well, now I'm really freaked out, so my heart's palpitating even more. And those often get confused. So we have a set of strategies, too much to talk about in detail right here, and we can help people to pull those apart, often based on helping people practice simple relaxation exercises as a place to start. And to realize that when I'm feeling is I'm low, I'm just having this fear response. So helping people tell the difference is often an important step to helping people to, again, regain that sense of confidence that they can not just be safe, but actually feel safe. I'm going to stop. Susan, what about when I mentioned about the last two we have here?
Yeah, that the hypoglycemia treatment practice. A lot of times it's really helpful. You know, Scott, you mentioned about like that your instincts are not to, um, eat 15 grams of carbs, wait 15 minutes. If you're still low, eat another 15 grams of carbs. That's not what, it's like a fire alarm going off in your body and your brain. And you're saying, get out fast. And so one way to practice the treatment to help you feel safe is to actually try out your favorite treatment for hypoglycemia when you're not low, so that you can see, gee, when I have this um, small glass of juice, it's going to take my body about 20-25 minutes to come up 50 uh, milligrams per deciliter. And so you know that that uncomfortable feeling, that sit on your hands feeling that you described, Scott, is going to take that much time. And so it helps you then see that it is an instant and that it does come up, but it does require time. So it starts helping people trust that that treatment actually will work when you need it. And you practice that when you don't need it, so that you can start to trust, gee, when I have this treatment, it will come up and I'm going to have to tolerate that very unpleasant feeling of being low for 20-25 minutes, and you get to see that it works. What do you think about that, Scott?
I love this idea because it is something that I think it's easy for us living with diabetes to kind of read and learn about how things are supposed to work. And this is an opportunity to really match that with personal lived experience, which really goes a long way to building that trust. So I love this. I love this idea.
Again, I want to underscore this. The idea that helping people gain trust, gain confidence is really the key to how you address really profound fear of hypoglycemia. People need to know that they can be safe and they can actually feel safe. And that's why strategy is so important. Let me chime in and mention the last one, which is about what's called graduating behavioral exposure. This is really at the heart of what we do when we're treating an anxiety disorder, many types of anxiety. And that's really what this is. In fact, one of the things we've discovered over the years is people who are really struggling with the hypoglycemic fear syndrome found way. There's often a history there. So they're sort of prime for having these kind of problems, or at risk for this happening, where you have a scary hypoglycemic event that combined with them already being at risk for an anxiety problem. So we put this last, but in truth, I can't even think of anyone I've ever met where we didn't eventually have to get to this point of saying, now to regain confidence, it's time to take some risks. It's time to put yourself in a situation where it's a little scary and see with these strategies we've already talked about, you can still be safe. So that can mean I feel a little funny. Can I wait 10 seconds before I, start eating something? Or can I take the risk of starting to take a little more insulin than I typically take, or going for a longer walk than I might typically take. And we sort of build things, one step at a time to help people know. And Susan and I have both seen how successful this is, how people can go, oh, work, I can do this. And that's why it's so important. And it really is a linchpin of everything we do. But we put it at the end because we want to make sure all other pieces are in place. Does that make sense? Susan, are you okay with that? That makes sense. So we put all these together, and we think this is a pretty good place for everyone to be able to start. We want healthcare providers to be aware of this. And of course, we encourage them to go read our article as well, which is published in Clinical Diabetes. But also to consider these separate interventions that we want to help people to be safe, but be aware that for someone who's been terrified about lows, that may not be enough. And we have to help people gain confidence and gain trust to feel safe and to understand there's both of those things that are often needed and how they can work. Yeah. So we could belabor this and talk about this all day, but we probably already gone longer than we typically done with our YouTube videos. So I feel like we should probably bring this to a close. Any last thoughts, Susan? Scott, what do you think?
I love the attention on building confidence. That's such a big piece of living well with diabetes. And that is often what's kind of swept out from under our legs when we experience a severe hypoglycemic episode. And so rebuilding that confidence, I think it's really important, and I appreciate the focus on that.
Susan, what about you?
I guess my final thought is kind of like we're at the beginning, which is we can't know people are feeling this way unless we ask. So don't forget to ask people how they're feeling about hypoglycemia, or how they're feeling about their confidence in responding to hypoglycemia. I think that just asking that question can really be a turning point for someone who has these challenges.
It's a really good point. We want healthcare providers to make sure they ask how important that is. Thank you. Scott, why don't you take us home?
All right. Well, first of all, thank you both for your great work on this and not only learning more about it, working to better understand what's going on, but also provide some very practical tactics that can be taught and applied. I think that's really helpful. So thank you both for that. To all of you out there watching and listening, thank you for your attention, and we look forward to seeing you again for our next episode.